My name is Alana Godelsky, and I am a sophomore bioengineering major in the College Park Scholars Science and Global Change program at the University of Maryland. For my practicum project, I interned at MedImmune over the summer in Gaithersburg, Maryland. There, I worked under the Department of Cardiovascular and Metabolic Diseases with a focus on in vivo pharmacology. My research focused on non-alcoholic steatohepatitis, otherwise known as NASH. Before I go into the details of NASH, it is important to understand what non-alcoholic fatty liver disease, or NAFLD, is. NAFLD is a buildup of extra fat in liver cells that affects 25% of people in the United States. It tends to develop in those who are overweight, have diabetes, or have high cholesterol and triglycerides, and can develop into NASH if the liver becomes inflamed. NASH is diagnosed with a liver biopsy and by examining ALT and AST levels in a patient's blood. If the fibrosis worsens, NASH can result in cirrhosis. At this point, the only choice of treatment is a liver transplant. These diseases are becoming more and more common due to the doubling rate of obesity in the nation, highlighting the importance of research in this area. I was lucky enough to receive the opportunity to manage my own study independently. The study's aim was to explore different mouse strains and novel diets in order to find an animal model that induced NASH progression. I was exposed to animal work for the first time. I weighed mice every day, collected blood samples, sham dosed, performed body NMR, and assisted in many necropsies. I also conducted insulin assays and analyzed all of the liver lipid and blood plasma data in order to present my findings in a final summer intern poster presentation. Overall, I enjoyed my internship thoroughly and gained very valuable research experience. At first, I was worried that I would not like working with animals, but I soon adjusted and realized how important animal models are in the biomedical industry. After all, drugs cannot get on the market or even make it to a clinical trial without being tested on animals first. I got to work with advanced equipment like the Cobas machine pictured and was even exposed to the business side of the industry. If you are interested in science, biology, or anything in the biotechnology field, I highly recommend interning at MedImmune. It has been awarded as the most exciting company in biotech, and I can confirm that it is an extremely fun, energizing, and motivating place to work.